Hey friends, I wanted to come on because there is popular information going around talking about the birth control pill and PCOS, and it is false, and I want you to know the truth. I am Dr. Natalie Crawford. I'm a board certified OBGYN and REI, so I'm a fertility doctor, and I am a true hormone expert. There are a lot of non-physician influencers on Instagram right now who are sharing information that is a scare tactic and self-profiting. And I just want to break it down really quickly in this video so that we're all on the same page, because PCOS is a really complex disease. And this is not new. This is not a new argument. We have been going over this time and time again. The tweet going around is saying that PCOS is being caused by birth control pills. And there's an entire generation of people who use the pill who now have PCOS, essentially blaming the pill for causing PCOS. Let's start at what is PCOS. I have an entire video on PCOS so you can learn more about the actual disease. So if we think about how the ovary normally works, you know I love the analogy that you have a little vault inside your ovary where all your eggs are made. Each month, a group of eggs comes out of the vault. Each egg grows inside a follicle. The brain sends out follicle-stimulating hormone, just enough to get one egg to grow. As that egg grows, it makes estrogen. That allows you to then trigger an LH surge from the brain. You ovulate, that follicle reforms, makes progesterone. If you get pregnant, yay, that supports the pregnancy. If you don't, then that corpus luteum dies after about 2 weeks, and you'll get a period from the progesterone drop. What happens is in PCOS, it is an ovarian disease where the ovaries do not function appropriately. This gets a lot of slack because there's a lot of stigma with PCOS. There's not so much stigma with thyroid disease or when other parts of your body are not functioning right, but when it's your ovaries, there's so much stigma and misinformation, and we see this in women's health all the time. In PCOS in general, it's a metabolic disease of the ovary. I like to think of it as being born with a large number of eggs inside the ovary. You then have a large number of follicles come out every month because the vault is trying to regulate things. The brain sends out its normal amount of FSH, and it is not a strong enough signal to get one follicle to grow. Think about it as getting dispersed amongst all of those small follicles. I love to think about the ovary as a hormone-producing factory. Its favorite job is to make hormones, and its favorite hormone is estrogen. It can only make high levels of estrogen when it's growing a big egg. All those tiny follicles make a little tiny amount. What then happens is that the ovary is not making those high estrogen levels, so it gets bored, and the LH signal from the brain can actually then stimulate the ovary to start making testosterone, because that pathway becomes very, very easy. This then leads to insulin resistance, and it can lead to further metabolic issues such as high blood pressure, cholesterol, and metabolic syndrome. You get stuck in this pathway with PCOS, and being overweight can emphasize the disease because fat cells make some estrogen, and that estrogen actually causes the brain to send out a little bit lower signal of FSH. So sometimes you'll hear people say lose weight if you're overweight because it will decrease some of your estrogen made from those fat cells, and then the brain's signal of FSH may be slightly stronger. However, if you have PCOS and you're not trying to get pregnant, the worst scenario is endometrial cancer. This is cancer of the endometrium, the inner tissue of the uterus. I like to think of the uterus as a cup. So in a normal month, non-PCOS, what happens is when you grow an egg, that follicular phase of the cycle, the faucet is on. Estrogen's being made and the cup is filling. When you ovulate and the body makes progesterone, the faucet gets turned off. So no more filling of the cup. When you do not get pregnant and progesterone drops, that's the signal to dump the cup out. Mine has coffee, so I'm not dumping it. But dump the cup out, and then you have a period, and the process starts over again. What happens with PCOS is it's like the faucet's always on drip. Teeny little amounts of estrogen come, but if you never have a period, this endometrial tissue has been sitting here for a really long time, and it can develop into hyperplasia or abnormal cells or cancer. So our worst case PCOS problem is not just that you don't feel good or you have acne or you can't get pregnant, it's that you have endometrial cancer and you might have to lose your uterus. This is why a treatment, if you're not trying to get pregnant, is to make sure you have periods or you prevent the endometrial lining from growing. Progesterone, what happens in that luteal phase, remember it turns off the faucet and stabilizes things. And so different options include a progesterone IUD, progesterone pills, or the combined oral contraceptive pill. So these are all different options to prevent endometrial cancer. Combined oral contraceptive pills have the added benefit of also decreasing testosterone production because it prevents secretion of FSH and LH from the brain, therefore lower drive to make testosterone, and it works through the liver to increase something called sex hormone binding globulin, which binds circulating testosterone, so you get a nice lowering of your testosterone levels. So some of the complaints that make PCOS really impactful on your life of having acne or hair growth decrease because now you're being treated for it. Also, we see a decrease in insulin resistance in these circumstances, in addition to preventing endometrial cancer. Now, the big myth out there is that the pill causes you to have these problems. But the reality is many people got started on the pill for a variety of reasons. Maybe you had irregular periods, maybe it was acne, maybe it was contraception, but you might have had PCOS and you were started as a teenager and you were treating your disease, meaning you're not getting these bad outcomes of PCOS right now because you're on the pill. Your period's coming regularly, you don't have endometrial cancer, you don't have insulin resistance, wonderful. But then you stop the pill because you want to get pregnant, and suddenly your periods start to space out, and suddenly you see an increase in acne, and this is just your body reverting to PCOS. I tell patients, you're born with a predisposition to PCOS. We know this. We know there's a huge genetic component, a huge environmental component, even from when you're in your mother's womb. It's not something that the birth control pill induces. And we can confidently say this because there's been lots of research on it. There have also been lots of research showing that the pill does not cause infertility. And I have an entire video just on the birth control pill, taking it for a long time. Does it cause you to not be able to get pregnant? And so one of the things you hear us say, your fertility doctors, is that you should stop taking the pill about 3 months before you're ready to get pregnant. And it is not that the pill needs to wash out of your system or it's bad for you. You could stop the pill and get pregnant the next month. That's fantastic. But it is so that if your periods are not regular after stopping the pill, meaning you have undiagnosed PCOS, something goes off in your brain, hey, it's been 3 months and I don't have my period, and you come in to see me so we can start an evaluation early. It has nothing to do with inducing the disease based on the pill, or that it's harmful, or that it needs to get out of your body. The pill is so short acting that if you miss one pill, you could ovulate an egg and get pregnant, right? You hear us talk about must take the pill same time every day. So it is not something that's causing these long-term damage, or that needs a really long time to get out of your body, or that is inducing change of your ovaries. When you take the pill, it tells the brain to stop sending out FSH and LH. The ovaries then are in a restful state. You also have a lower risk of ovarian cancer. Yay, ovarian cancer is one of the worst cancers that's out there. So the pill is not for everybody, and I'm not here advocating that you take it. I use it very frequently in IVF cycles and treatment cycles because I'm trying to manipulate your cycle to get the best outcome. And if the pill caused infertility or PCOS, I would not use it in my fertility patients when my whole passion and my life calling is to help you get pregnant. I would never do that if it was going to cause harm. And I really need you to understand this disease so that when you see this misinformation going around, you understand that it is not rooted in science or fact. It is actually coming from people who are not hormone experts, do not understand the body, and are trying to scare you into buying their post-birth control pill syndrome, a made-believe syndrome, their books and their cleanses and their supplements. So they are using your fear against you. I think you're fearful because who wants to do something that's going to hurt themselves? I know you don't. And that's why I just wanted to break down the facts. This